This is Martin Zollinger from Reform Body Clinic in Ottawa. I wanted to shoot this short movie about low back pain and, more importantly, any kind of sciatica or sciatic pain that people have experienced. I just got off the phone with a gentleman and he's starting to lose a lot of quality of life because of sciatic pain. And for those of you who don't know, sciatic pain is pain that starts in the low back and it travels down the leg. And so when you have pain that travels either down the arm or down the leg, it just means that that nerve is being compressed somewhere around the spine. And that's why you notice pain that'll either go from the neck, these nerves down the arm, or from the low back and these nerves right down the leg. So I hope that makes sense right off the bat, that if you do have kind of chronic pain that is shoulder, arm, or chronic low back, hip into the leg, that it is a spinal problem, and we call this sciatica, especially when it involves the low back and the leg. Now, clinically, when there's pressure on the nerves in the low back, oftentimes it has to do with something called stenosis. Now, stenosis, more the medical terminology, not to get too technical, but it means that the nerves are going through a hole, and over time, there's just pressure building on those nerves, and that's why that nerve gets in trouble and legs go numb, etc. So far, so good, and I hope you're getting something out of this because it's a debilitating condition. So I'm going to show you guys a model of the low back. Up close, it's quite a technical structure. You have, of course, bones, joints, ligaments, discs, and when we talk about nerves coming out of the back, these are them, right? So your low back looks exactly like this. These nerves are coming out and going down to the leg. And on the way down, they're sending nerves out to the hip, the groin, even back into the bowel, bladder, reproductive system. So really important nerves for long-term health and function. And again, primarily focusing on sciatic pain today. Pressure here will cause leg pain, okay? So how do we fix that? My purpose today was to give you guys a few simple stretches you can do to start taking pressure off the back, start taking pressure off these nerves to make sure that that nerve isn't under pressure causing you, numbness and tingling down to the foot, hobbling around because your leg's not functioning at 100%. Now, I do want to be a little technical here that these videos are not for diagnostic purposes because stenosis and sciatica can actually have a couple different root causes. And they are treated very, very differently. So for example, and if we can zoom on this guy one more time, what you're going to see on this model is here is an inflamed disc. So these are the intervertebral discs. The pressure on that disc and the inflammation can cause this nerve to get in trouble and cause sciatic pain, okay? Sometimes you can also get arthritis, which is the physical breakdown of the spine. And in the back here, you start seeing these joints start to become deformed over time and pressure develops from the back. And I'm going to show you some exercises more for the disc today, because you would actually do a very different set of exercises for the joint. So of course, guys, if you have chronic sciatic, low back pain, numbness and tingling into the hip or the thigh or the leg, you do need a proper assessment to figure out what to do, okay? So back to this just one last time. So when we think of you sitting there with a spine, if we have a disc like this one that's pushing onto the nerve, the very simple thing to do is get an assessment. We would need to do some adjustments of your spine and some testing, but there's some great exercises you can do bringing your spine this way, okay? And that's going to really help take pressure off the nerves and the discs and the structures in the spine to alleviate sciatic pain, okay? So get the diagnosis, but what I want to show you is a really simple exercises for back pain, especially when there's pain down the leg, okay? So I'm going to use a chiropractic table, but you can do this on the floor, do it on a yoga mat, but very simply, what you can do is lie flat on your stomach, okay? You can actually probably already see what's happening to my low back in this picture. So it's actually doing an arch backwards. You're gonna come up on your elbows like so, and you're just gonna sit and let your back completely relax, okay? And there's a lot of research and evidence that this is gonna help move disc tissue away from the nerves and help with sciatic pain, okay? So under direction of a professional, I mean, the next thing you would do if this goes well over the first couple of days is you can actually get both your hands up on the table and push up just a little bit further, okay? And now you're just working a little bit harder to get pressure off those nerves going down the leg. And then finally, there's an element of rotation you can add to this. So the third would be, you'd be putting one elbow down, pushing one elbow high, and rotating the spine both ways. So you'd actually do this both ways, this stretch, okay? So elbows, hands, and then the rotation, okay? So I hope you guys get something out of this. I mean, these videos help me help you. I hope so. If anybody's watching this, the ultimate thing here is to try and keep you healthy and mobile for as long as possible. We know that statistically 80% of Canadians have back pain, and that statistic means that most people are struggling with the mechanics of how a low back works. They're throwing their back out, they're injuring it, but ultimately when things get bad in a low back, it really affects quality of life. Giving up running, swimming, not picking up the grandkids, whatever it might be. And that's what my goal here is, to give you enough information to make an informed decision on how to help keep healthy and mobile to enjoy all those things you want to do. So I hope that helps you guys a little bit. You can tag someone, you can send this to anybody you like who you think should learn about this kind of problem and help. Because there's a lot of people out there looking for help with things like low back pain and sciatic. So again, Martin Zollinger from Reform here in the beautiful Byron Market in Ottawa, and I will be in touch with you guys next week for another short clip. Take care.